the replay. We still have people joining the Jumpstart, so if you are new or you're needing support getting caught up here, there are 3 pieces of info for you today. It's the same as before, right? Text Leo, 415-688-2045. Leo is your concierge and will help you with everything Jumpstart related. Replays, workbook, and access to the Facebook page and group can be done at pffljumpstartreplays.com. And if you want to get on Zoom, head to pffljumpstartzoom.com instead. Important notice, okay? So we have slightly extended the deadline for joining the reset from 5 p.m. Pacific time to 6 p.m. Pacific time on January 31st. That's tomorrow when the reset closes. Now, this is to accommodate time for people to watch the Inside the Treatment Room session with myself and with Annie before signing up. I want you to have the time after we have had our discussion and you've asked those questions to be able to still get in there without being, it's all over instantly at that point. So please remember, to that effect, all of the replays and this group is going to be closed down on Wednesday at 6 p.m. Pacific time. So that's 1 hour later than it was before. This is also when enrollment closes for the Hash Protocol reset. So remember, as a bonus, when you purchase the reset, you're going to be able to rewatch the Jumpstart event as well. Now, this week is different than last week. Last week, I went through the 5 structured lessons in the workbook. If you haven't done those yet, there's still time to watch the replays and catch up. But this week, I'm focusing on our bonus content sessions for the Jumpstart. So you can check your event listings for what's going on there. They're listed in the Facebook group and in your workbook schedule as well. So we also have one more closed door meeting today. So if you'd like to get in and ask me questions about the reset, that is happening in 1 hour at 5 p.m. Pacific Standard Time. So if you have questions about the Hash Protocol reset, please text Leo to get the invite for the event. That is the only way to get an invite to the closed door sessions. For those of you not on social media, you may not have heard this yet, we're also doing a special bonus for the 121st person to sign up for the Hash Protocol reset. That's a 30-minute one-on-one session with me. Why 121, you may ask? It's a very weird number. I talked about this in the Jumpstart page, but this week has been all about anti-inflammatory therapy in order to resolve the root cause of your disease, which is inflammation. And interestingly enough, 121 hertz is a key anti-inflammatory frequency that is in our microcurrent devices. So we're not going to tell people where we are at in the sign-up process, but we are almost there at that 121st person. So sign up for a chance to win that session with me and join the other 100+ people that are already in the reset, ready to get started. Okay, so as for today, let's dive into our bonus session. All I have to do is be able to find my PowerPoint. There it is. Okay. And if you have any questions, okay, I'm just going to say this now before we get started. If you have any questions, I don't answer questions during these presentations, but I do during the Q&As. So make sure that you post the questions to everyone so that my team can snatch the questions up and bring them to the Q&As for you to be able to get them answered there, okay? That's just because we keep this pretty streamlined so everyone can just watch and enjoy the lessons without me interrupting myself all the time to answer all the questions. So make sure your chat is set to everyone because otherwise my team will not be able to see your questions, okay? All right, so 5 exciting ways to use microcurrent outside of healing pain. So welcome everyone to day 2 of our bonus days. Again, today we're covering those 5 exciting ways to use microcurrent outside of healing pain. Last week, we covered the 5 core lessons of the Jumpstart, and yesterday we covered an expanded lesson on developing the pain-free for life mindset. As one of the elements of the Hash protocol, microcurrent is an absolutely essential piece of the puzzle to restore the electric body to normalcy and to really allow the body to heal from chronic pain. But it's one of those tools that we can discuss in a light of what can't it do, more so than what it can do. And this is something we see a lot because we're constantly saying, well, can it help with this? Can it help with this? Well, there's so many things we can do with a functionally electric body that the microcurrent kind of applications, I suppose, become almost endless. So, cosmetic treatment. So microcurrent therapy can be used for way, way more than just pain. One of the things it's most well known for, actually, if you Googled microcurrent, is going to be cosmetic treatment. So microcurrent gently tightens, stimulates, and tones the face for a more natural and youthful looking appearance. And the results are immediate and they last up to 10 days. The device delivers an easy and effective microcurrent facelift by delivering gentle currents to your skin through metal electrodes. Your skin is then lightly stimulated to mimic exercise naturally. It's kind of like a workout for your face, right? So Dr. Laurie in her cosmetic training even talks about how to perform breast lifts and goes beyond this into the health side of cosmetology as well, because beauty is not just skin deep, it's a cellular thing. So the interesting thing about these cosmetic treatments is that when you use something like this medical grade microcurrent for the treatments, you're actually getting a stimulation of tons of reflex points that will directly reflect health concerns in your body. The image here on my slide shows us where blemishes and lines can relate to these potential issues within the body. And by stimulating these points, you actively stimulate the tissue of the body and you give yourself what Dr. Laurie calls a true cellular makeover, kind of inside and out. You'll notice that if people are dealing with things like, for example, stomach, kidney, liver problems, these can be shown under the eyes in the forms of wrinkles, bags, etc. And being able to treat this area here will not only help get rid of the wrinkles, but it will also treat the stomach, the kidney, and the liver. The same goes for all of the areas of the face. You've got areas that connect to the colon, the stomach, the lungs, right? The ears themselves connect to the kidney. And then you even have the gallbladder and beyond, the heart on the tip of the nose and the bridge of the nose. So wherever you end up working, you're going to be improving the cells of your body throughout. So the cosmetic side of microcurrent is definitely something that people get really excited about, but typically they focus primarily on the pain management, getting rid of their disease, and then they kind of move on to the cosmetic once they have achieved those results they're looking for. What about immune boosting? This is something that always surprises people as well. Microcurrent therapy for immunity looks to clear glands, to stimulate the creation of white blood cells, and to release these new white blood cells into the body. It's a really fascinating process. I'm actually going to go through it in a mini teaching lesson, essentially. So hopefully it will make sense to you as to how we do it. So first off is Pirogov's ring. And the crazy thing is, right, is this is all about immune boosting. The average person touches their face 2,000 to 3,000 times per day. And that may be a brush. You know, I'm pretty sure I've probably done it 20 or 30 times since I loaded up the screen here and went on live. It's crazy. It is a crazy amount of contact points with the face. And every time we do this, we're potentially transferring the invaders to the entry points, right? The eyes, the nose, the mouth, and so on. These kind of glands in our neck, these provide a second line of defense because the first job of our body is to protect things getting in. And if we're going to help them get in, well, we need something to protect them as that second line of defense. So all these glands in our neck actually play a vital role in our immunity. And some of us, myself included, are even missing our tonsils, which secrete like a sulfur to destroy invading pathogens. So they are not going to be affected if we don't have them. But even so, the lymph glands in the neck as well are critical for trapping viruses and bacteria. Now, Pirogov's ring is the first protocol step here that we use when we start to get sick or when we're worried about getting sick, because it ensures that the glands, whether they be the tonsils or whether they be the lymph nodes or both, are actually clear and ready to absorb those invaders. So I'm going to show you in the picture here. You can see the thyroid gland here. We actually avoid the thyroid with microcurrent Pirogov's ring I've demoed in a few Q&As, but you essentially start on the back of the neck, you sweep around here, and you end on the back of the neck, and then you reverse it. So you end up back on the other side. And this sweep here is reducing and eliminating the inflammation in the area so that you actually open up those glands. Step 2 is probably the most fascinating part. We call this the long bones. This works on the premise of stimulating the creation point of white blood cells, which is in the bones, in the bone marrow. In practice, what we're doing here is activating the uncommitted stem cells in the bones by stimulating them and getting them to become committed. So you can see this diagram here. I think it's an absolutely beautiful diagram. But it's from the Mayo Clinic, so that makes sense. They've got a nice big budget. So the bone marrow here. So you end up with all these uncommitted stem cells. When you stimulate them with microcurrent, you're asking them to commit. And they're either going to become a lymphoid stem cell or they're going to become a myeloid stem cell. Now, if they become a lymphoid stem cell, well, they're going to become white blood cells. Like that is just what happens, right? So you're going to get these white blood cells, T cells, natural killer cells, B cells, even just plasma cells as well. And the myeloid stem cells, these can become different things as well, including new red blood cells, but also white blood cells. So we stimulate these to, at this point, on the end of what we call the long bones. I'm not sure if we have pictures. We don't. So the long bones will be all these connection points here, right? So like the connection of your wrist to your elbow to your shoulder. This is where the sockets join in. That's where we want to stimulate those. And we do our biofeedback process to activate them and get the feedback from the device that we've done so. So that's step 2 of the immune protocol. Step 3 is to work on immune organs. We have the thymus, the liver, and the spleen. And these immune organs, when treated over the surface of them, so you're not reaching into your body and doing the treatments here, you're going to work over the surface of the body itself on those areas to open those pathways up. The thymus is where the blood cells that we create when we activate them go and harbor, waiting to be released. The liver plays an important role in the immune system because it participates in cleaning out the lymph nodes. And the spleen is where our tumor necrosing factors are created, which we use for our immunity as well. And again, in chronic pain, the tumor necrosing factors may not be great, but the activation of them for dealing with an immediate invader is a useful tool as well. So that's a factory we want to keep running smoothly. So that's the immune component of microcurrent. Again, it's not something that you would typically think you could actually do, but we use this protocol with all patients throughout the COVID pandemic with amazing effect. Treatment of mental health concerns. This one surprises people a lot too, though I've kind of hinted at this throughout the presentations last week and this week as well. Just as our body speaks the language of microcurrent, our brain speaks it as well. Microcurrent therapy gives us the option to actually attempt to address mental health concerns through stimulation of the head directly and associated points. This has been used to treat conditions like anxiety, depression, PTSD, brain fog, ADHD, and even last year, I started working with some patients with dementia and Alzheimer's and getting some amazing benefits from these programs as well. All of this is through asking the brain to change its waveforms and shift to different states. To me, there's kind of a trifecta of microcurrent treatments for the brain that are so multi-purpose that they should and can be employed by anyone. The first of these is the neurofeedback alpha program. This keeps us out of fight or flight mode, it reduces body stress, and it enables the body to repair. If we are in alpha, we are safe. So when we're dealing with that fight or flight response, this is a way of putting the brakes on that and pulling us out. Through the use of these ear clips, we can use the device to keep ourselves in this state. It's also kind of the perfect mode to sit in before you go to bed because it will get you in that relaxed, calm state so that you can actually drift off to sleep. Many people will report almost instant sleep benefits when using this protocol in the machine. And really the ear clips, nice little easy tools here to apply. They're just plastic and metal. They're not tight. They don't clamp onto your ears. They kind of hang loosely on there, but very, very effective for these protocols. This neurofeedback gamma protocol was what we used when we developed the PTSD protocol. And we actually took this protocol from the National Institutes of Health, who were doing a study on PTSD in veterans. And they created a microcurrent device solely to stimulate the area on the forehead and the brain with gamma waves. Well, we decided to try and copy that, but we asked, because we didn't have any practical application data, we asked our private membership to help us out and report back over the course of, I think it was 6 weeks treatment. And the reason was that was exactly what the National Institutes of Health were doing. So we offered 2 different protocols to see, and this is the one that got the results. The other one barely did anything for anyone. So this was the way to go. Essentially, you place these pads above your eyebrows or in the center of your forehead, which is what we tend to do more now. And you run the program for 30 minutes with a comfortable tingle. What this does is it works to cleanse the brain with gamma waves, the same waves that you'll only really achieve naturally in high states of meditation, but that many of us can't actually reach without the assistance of something like this. The results we saw were awesome. 95% improvement in anxiety, an 85% improvement in depression, a 75% improvement in PTSD, and a 90% improvement in sleep length. So people sleeping longer. We also saw a 75% improvement in ADHD. It is my belief, and I say this whenever I present this data, that the sleep length, which we were not recording for at all, being improved so much is likely because as symptoms of anxiety and depression and PTSD reduce, the ability to fall asleep earlier and easier increases. So I think it was just a correlation. I don't think that this program actually will help you sleep if all your issue is sleeping. It's more along the lines that it helps deal with the underlying mental health concerns that prevent the sleep in the first place. And the other one is one that I've talked about all week, which is vagus nerve stimulation, right? This is the way to flip the switch on inflammation. And the vagus nerve, it's a direct hard phone line to the brain to get that help and assistance and pull the brain out of fight or flight. It is a very important anti-inflammatory technique, and it's one that we like to use very, very often for anyone dealing with inflammation. In doing so, you're going to end up with a lot of benefits to these mental health issues because you're going to be resetting and calming your nervous system down. So it's kind of the way to go in that way. Another thing that most people don't really see coming with microcurrent is its capability of treating the eye. And I bring this up sometimes. You might mention, oh, it works on eye conditions, and people are like, hold on, what eye conditions? Well, that's what I'm here today to tell you about. Vision is something that I think we hold very dear, but only really when we are at risk of losing it. I think it's something we take advantage of a lot. And we're kind of bound by this idea that we're impervious to lots of problems, kind of like with chronic pain until we experience it. And this problem with eyesight is just as bad. We take for granted that we can see and that we will always be able to see. And when degradation actually happens, it really creeps up on us and it's very shocking. We believe that, you know, the eye doctor can fix it. It's going to be gradual. We probably just need to wear glasses, you know, and then we'll get a stronger prescription. But eventually it gets to the point where this degradation can actually be threatening your ability to see in general. And the unfortunate truth is that over 75% of people will suffer from eye issues eventually. This is kind of a natural process because what happens is as the circulation to our eyes is reduced, or as the circulation in our bodies in general is reduced, the eyes are one of the first places to go. The most important things are, of course, our vital organs and our extremities to maintain movement. And vision, while we may see it really important, it doesn't seem to be a biological imperative. It's one of those first things that the brain seems to start to neglect. Now, when it comes down to doing the treatments here, we look into doing just that, increasing circulation to the eye. And whether it is macular degeneration, whether it's glaucoma, whether it's cataracts, all of these things are kind of considered age-related, right? With age, they happen. People are like, oh, you're just getting the start of cataracts. That happens to people your age. Or it's age-related macular degeneration is actually the name in most cases. And it's interesting to me because it doesn't seem to be age related at all. It seems to be cell related and blood flow related. Do you have enough blood cells to bring the nutrients to your eyes to keep them healthy? In most cases, these are just natural degradation of the body. So microcurrent actually has a very solid history with eyes. As early as the 1990s, microcurrent therapy has been used to treat the eye. Essentially, you would use a wet towel, you'd soak the towel, you'd wrap it around your head, and you kind of clamp it in place with these gator clips, which kind of look like what you use to charge your car, jumpstart a car. And really what they're doing is they're using that to deliver current to the eyes, right? It was a way of clamping the current on, and then the water and the wet towel will essentially deliver the current to your eyes. Well, treatment has come a very long way since the days of wet towels and, Frankenstein's monster clamps. Microcurrent works for the eye by multiple different avenues, okay? The first thing is that a healthy eye needs adequate ATP, which is adenosine triphosphate, which is your cellular currency, and it needs removal of waste. It needs the ability to get rid of the waste. Each cell in the body is powered by ATP, and as we age, ATP does decline naturally. Microcurrent stimulation helps stimulate ATP production by increasing blood flow. So you're bringing in more oxygen, you're making the cells happier and healthier. Increased blood flow, therefore, enables efficient removal of waste buildup. We've got the garbage trucks going in and we've got the garbage trucks coming out. So as long as these pieces are all lined up and we have adequate nutrition for the eye as well, then you're on the right path to generating that success. So as far as conditions that microcurrent can treat for eyes, it's pretty numerous. Microcurrent successfully treats an array of vision issues, including spasms, scars, fatigue, long and short-sightedness, astigmatism, age-related macular degeneration, that's AMD. Although we do typically say only the dry macular degeneration, there is a protocol to deal with the wet macula, but you need to do a few extra steps with supplements to have any chance of successfully treating wet macular degeneration with microcurrent. Cataracts, glaucoma, conjunctivitis, uveitis, just an injury to the eye socket itself, and even presbyopia, which is your trouble seeing up close. People have even used these just for general vision improvement when they're having a hard time seeing, right? So the microcurrent treatment of the eyes is an interesting piece. We used to have an attachment specifically for the eyes. We currently do not have it. So we've been telling people directly to take the Y probe, close the eye, and treat directly on the eye itself to increase that blood flow and stimulation. Usually it's 2 to 3 minutes for eye treatments. It's pretty short, and you'd of course need to do both eyes with the probe, but it's a nice and easy way of seeking and obtaining those health benefits for the eye. Okay, healing chronic wounds. That's the other thing that we see huge benefit with microcurrent. In fact, we've just completed studies, the peer-reviewed studies at Stanford University and Baylor School of Medicine with wound healing. And we're actually on the verge of getting our FDA approval for the treatment of chronic wounds that are non-healing, which is huge. It's taken a long, long time to get there. So yeah, absolutely very exciting that we're getting there. Microcurrent has shown us time and time again to be a lifesaver for wounds, and we constantly hear of successes with the healing of chronic and acute wounds. There's no surprise there. Microcurrent can enhance circulation by up to 480%, remember. That is increased blood flow to an area that delivers building blocks required to actually repair the tissue. Couple this with the removal of inflammation, which is stalling the healing in general, and you have that recipe for healing. First off, we typically want to see that inflammatory phase in a wound, and this is where most wounds get stuck, in that inflammatory phase. It doesn't go away, so they can't heal. Then we get the epithelialization phase, which occurs when the body begins to kind of create that scab over the wound. That provides some temporary protection to it, where we get to the maturation phase, where we can essentially heal the body with scarring. And then, of course, with microcurrent, we remove the scarring after the fact, or just treat it while doing that to prevent scarring in the first place. So we have some examples here of chronic wounds that we've shown in the past. Some of these may be familiar to you if you're new. These are some real life situations that we have treated here. This gentleman was 36 years old when the electric arc welder he was using exploded in his hand and covered 20% of his body with burns. Treatment started on the second day with microcurrent. Now, on day one, you can already see here how swollen he is. You may just think he's a big guy, but you'll see the comparison on that final picture there. But you can see all the burns all over the body, and it's kind of the same with the hand here as well, right? It's really rough to see the burns. Of course, he was holding it, so the burns on the hand were worse. 4 days later, so 5 days after the initial event, he looks like the second picture here. There's definitely a lot less scarring. You can even see facial hair has started to grow back in, which would be very hard to do if you hadn't removed the scar tissue, because all of those hairs would have been burned down the follicles, right? So he's starting to heal up nicely there, and the hand is doing quite a bit better as well. An additional 10 days later, so all this occurred over 14 days of treatment, this guy is not even recognizable from the guy in the first picture. The hand has still got a little ways to go, but you can see a lot of the inflammation has gone down and it's starting to repair. This was exclusive microcurrent treatment. This was not mixed with other things. So there was no surgical intervention or anything required in the case of this chronic burn. And we've worked with people with burns for that very reason multiple times to huge, huge success. This was a patient that came into our clinic and essentially he had been on a military training exercise in the north of Canada in the snow, and he climbed into his tent at the end of the day and he didn't take off his wet socks. Well, anyone that knows outside stuff will know that that is not a good thing, and he contracted frostbite across his toes. When he returned to the base, he was airlifted out of there. He was seen by a medical base doctor who said that they were going to have to schedule an amputation for Monday, for just 3 days later. Well, the base medic happened to know us and know of our wound healing success, and so encouraged the guy to come and see us. We treated him on that Friday, again, 3 days till he was supposed to have his toes removed, and we sent him home with a device to treat himself as well. The toes themselves, by that Monday when he came running over, are no longer black. So we were able to restore circulation and with it life to those feet, and he got to keep his toes. So happy ending right there. This was a daily treatment of a non-healing wound sustained in a nursing home fall. This happened during COVID as well, so it was definitely hidden from the family member for quite some time. But essentially, you can see just how red and inflamed the area is here. The inflammation stopping the healing of the wound. Once you start doing treatment, the tissue can turn itself back around. And this went from this bright red pinkish skin to normal colored tissue. That's the big thing there. It's not even the sealing of the wound. It's the fact that that inflammatory response has been removed so successfully. This is a really old one as well. And the pictures get a little bit backwards on the second page here. But this was a skin graft. So for anyone who doesn't know, that's when they have to take tissue from one part of your body to repair another. In this case, this guy got thrown from a horse and the horse stomped on his skull. So he got rushed to hospital where they used some tissue from his arm to patch the skull up, essentially, patch the hole there up. And immediately they just started their microcurrent therapy. They slapped the device right on the wound itself, and they just started to do the treatment. You can see the tissue growing back before your eyes and ultimately ending up nice and sealed just the way you want it. So all of these things and more, right? That is what we can really see with microcurrent. Microcurrent continues to surprise people. And I mentioned this at the beginning of the presentation. It's often easier to look for what microcurrent can't help with than with what it can. But all of these things and more can make it a tool that even after you've resolved the issue you're trying to treat in the start, it becomes a helpful tool to have around moving over time. So now we're going to talk briefly about the Hache protocol reset, and then we're going to get ready for our closed door session as well. So the Hache protocol reset, I revealed last week that the reset was happening and everything about it. So you can definitely watch it in more detail there as well. But just for those of you who are new, and there are some new faces here today, this is our comprehensive program that goes beyond the surface of everything we've been scratching in the Jumpstart and gives you all of the resources you need for success. We've had a big influx of people, again, that we've been invited by our original attendees. So I do encourage you to watch the replays at pffljumpstartreplays.com. The goal of the reset program is to provide you with ways to take ownership and to be your own advocate, and to enable you to take action and to provide you the support you need to remain consistent in getting the healing you're looking for. The reset has two options to sign up, and you can sign up today. It's available right now, and you can even get started right away before the Jumpstart even ends. So in the reset, you get 12 training modules and our comprehensive workbook. You can see it's a very thick workbook, the Hache Protocol Reset workbook here. Lots of work to do in this book. 12 training modules cover all of this. You can learn at your own pace in the private learning portal. And you can, if you would choose to, join us on Facebook, though it's not required to succeed in the reset. I will review all of your supplements and make new suggestions. I'll probably be cutting a bunch out. So you got to tell me why you're taking them, because I see supplements as something that are not required to heal in most cases. You'll get access to our Hache Protocol Reset cookbook, and we'll be doing monthly live Q&A sessions that last 60 to 90 minutes, where myself and Annie, who you can meet tomorrow, will be answering any questions that are asked, so you can get clarity and peace of mind on the spot. We also have numerous bonuses as well, personalized treatment protocols with our treatment coordinators, our stress management and nutrition management toolkit, and 90 days access to the Hache Protocol membership for additional support. Now, there are two options here, as I said. This is the program only. So this is for people that already have a microcurrent device and are ready to get started in the reset right now. You can pay in full and save $290, so it's $1,495, or you can make 3 monthly payments of $595. However, you actually get the program even cheaper if you use the Jumpstart code PFFLJUMP24, okay? This will save you an additional 20% off both the payment plan and the course itself. For those of you looking to get a device, you get the exact same program, but you also get the Evolution Deluxe Kit, which is our top-of-the-line home-use microcurrent device, usually valued at $2,000. You can pay in full here and save $690. You'll be paying $34.95, or you can pay in 3 monthly payments of $13.95. And you can still apply the 20% discount, PFFL Jump 24, at checkout to save even more. Whether you use a payment plan or you pay in full, you will receive the device right away. We will ship it right away. We don't hold it until all payments are complete. We know how important it is to succeed in healing to get that device. So those are the two program options we have. The device itself here, this comes with all the attachments that you'll need to properly succeed in the reset. This includes our Avazzia Life Evolution microcurrent device. You see how small and handheld it is here. Nice battery-operated machine. This machine is the core unit that delivers the microcurrent frequencies through the attachments. The attachments you get include everything on the screen there. Our Y electrode, brush electrode, and pencil electrode are convenient attachments to treat different areas of the body and to perform different treatments like acupuncture point stimulation. You'll also get our wires that you need to connect all those attachments, as well as conductive pads for your body, for your vagus nerve, and for your trigeminal nerve to work on the brain, and even ear clips as well. You'll be getting all of this in a nice handy carry case. It's different than the one on the screen. It's actually a little bit bigger and improved since that photo was taken. So you will get a nice storage space for all of these tools as well. Not only that, but through the Jumpstart, there are bonuses as well. Now, these bonuses, and it's important to note because I created a little bit of confusion the other day, these Jumpstart bonuses are only available for a limited time. So they're only during this Jumpstart event. So they're going away tomorrow night at 6 p.m. Pacific time. But for people who do register for the Hash8 protocol reset, you're going to get all of these bonuses here, okay? This is saving 20% on, of course, the program. So you'll be getting PFFL Jump 24 to save on the Jumpstart program, right? So the program or the program with the device. You'll be getting access to replays of the Jumpstart and assets, including the slides, even after we take them down from the public eye. So you'll be able to rewatch everything we've covered this past week and a bit. You'll get a live self-care course with me on February 6th. You'll be able to show up live with me. We will work to go through this self-care planner and fill it out together. I'll teach you how to use it and how it can help you when you move into the reset courses. You'll also get our ebook of Current Medicine 3rd edition, as well as the ebook of the Hash8 protocol for pain resolution, which is our Wall Street Journal best-selling book, and our anti-inflammatory cookbook ebook as well. So you'll be well set up there to succeed in the reset. You can register today or at any time before January 31st at 6 p.m. by going to the hash8protocolreset.com. Do not forget the code PFFLJUMP24. That's the code you want to use to save that 20%. So that's all for today. That's all for now. However, if you've got some questions for me, join us in the closed door session. Reach out to Leo. That's going to start in just about 20 minutes now. And we can kind of hammer through these questions and cover everything that might be on your mind. Okay, everyone? So thank you very much. I will see you all shortly. Take care.